My name is Jesse Bliss. I'm the director of Loma Linda University School of Public Health's Office of Public Health Practice and Center for Public Health Preparedness. The Center for Public Health Preparedness, in response to the earthquake, put together a public health disaster assessment and response team. When we first went down, our goal and attention was focusing on the assessment. We needed to get some baseline information so that the funders and the NGOs working down there would know where to direct their resources. When we got on the ground, we found, however, that in a camp of 20,000 internally displaced persons, that we had very little access to sanitation or safe water services, and so we needed to do health education activities around that, and also to work with certain water sources in the camp area that people were getting access to that were not filtered. Additionally, there were only 3 latrines in the campus for the 20,000 people. For each 20 IDPs or each 20 refugees in a camp, we need to have 1 latrine. And so with 20,000, you can do the math quite quickly. With only having 3, we were in a dire situation. So we immediately started organizing volunteers to dig trenches for latrines, as well as we were able to finally get a backhoe, and we dug a large pit to be able to start putting trash in. Our team actually just 2 days ago received an invitation and request to return back down. So we're going to send 2 members of our team down for 4 weeks this time. And then during that 4-week time period, we're going to work on implementing more health education and disease surveillance, as well as stepping up our efforts around the sanitation and hygiene. The next step is to begin working with the community to help them identify where they're going to go next, looking at more of the long-term planning for getting them into transitional housing. It's going to take time. You know, we're looking at 3 to 6 months in getting people moving on. The sooner regular activities return to normal after a disaster, the better the population will respond. You know, one of the things people ask, you know, how do you guys keep going? You know, how can you keep going when you're facing such, adversity and a disaster of such magnitude? Where do you begin, and how do you find the passion to do that? And I think that that's something that comes from within people who really have a passion for this work. Just continuing to be able to pour our efforts in there and seeing that each day we're on the ground, we're making a difference in the lives of the people there. We're preventing people from getting sick. We're helping to address the needs of the community. And that's really what was feeding the team.
My name is Ryan Sinclair, and I work with Loma Linda University School of Public Health in the Global Health Department. I went to Haiti with the group from the Center for Public Health Preparedness. Most people didn't have tents. Most people didn't have, clean water or anything like that. There's 1 latrine for everybody, so the conditions were pretty poor. We were going there and just responding as fast as you can. You're just trying to keep people alive for the next, or meet their needs, for basic needs for survival.
My name is Andrew Haglund. I'm an assistant professor of Geographic Information Systems in the Environmental Health Department of the School of Public Health. My title in Haiti is Haiti Relief Hospital Administrator at the Seventh-day Adventist Hospital, Hôpital Adventiste de Haiti. We're only about 1,500 meters from the epicenter of the initial 7.1 earthquake. And I've worked alongside the existing administration there at the hospital to help coordinate all of the relief efforts. In the first days after the quake, a field, kind of a MASH operating room was set up outside the hospital under a blue tarp. But we do have the main 2 operating rooms in the hospital functioning, as well as a 3rd room that's been converted. So we have 3 functional operating rooms inside the hospital. The structure of the hospital itself, we have been given a green light status for the main hospital as well as the 2 outbuildings. Every volunteer group has been put to work. We're trying to send the message that we have to be strategic about our volunteer groups, and we don't want just everyone to come, but those groups that are on the ground, the amazing cooperation has been, I think, touching for many of us there on the ground. Actually, my GIS experience came in extremely handy, not so much doing any GIS, but my connections with environmental systems research in Redlands. I was able to use that satellite imagery to convince most of the Adventist Church that our hospital was intact. I could see there was activity on the ground, and we needed to get there as quickly as we could. So we have set up a blog that I maintain as much as possible and is monitored and a little bit of help from Loma Linda University, and that blog is lluinhaiti.blogspot.com. What do we need? How can you help? How can you get involved in our relief efforts? The challenge with Haiti is the logistics and distribution of anything, be it food, be it water, be it medical supplies. And so sending canned goods or blankets really isn't an option, which is kind of a typical response. The biggest thing you can do to help Haiti, and most specifically the Adventist Hospital in Haiti, is to donate to the LLU Haiti Relief Fund, which you can get at the LLU website. There's a very large red button for the Haiti relief effort.